Hi everyone, this is my new channel. In this channel, I'm gonna talk about different medical topics that is gonna be directed to medical students who are planning or who are taking USMLE steps or whoever wants to learn about medicine. The first topic is delivery. Delivery, also known as labor. In the first slide, we have a partograph. Partograph is the physical representation of what is happening in the delivery. Delivery has 3 stages, 1, 2, and 3. In this stage 1, we have is divided latent phase and active phase. The stage 1 starts when the pregnant woman start to feel like start to have adequate uterine contraction. For how it can be described like adequate uterine contraction, basically occurs every 2 or 3 minutes, lasts approximately 45 to 60 seconds, and has an intensity of 50 millimeters of mercury. Stage 1 is divided in latent and active phase. Latent is from the onset until the cervix is dilated 6 centimeters. Varies according to if the patient is primiparous or multiparous. Primiparous is going to last 6 to 7 hours up to 20 hours, and multiparous 4 to 5 hours up to 14 hours. The active phase is going to be from 6 centimeters to 10 centimeters. And also, or basically, active phase is until the cervix is fully dilated. In primiparous, it's going to be more than 1.2 centimeters per hour. The cervix is going to dilate more than 1.2 centimeters per hour, and multiparous more than 1.5 centimeters per hour. What happens with this latent phase is prolonged. It's called prolonged latent phase. Basically, is when in the primiparous woman, the cervix doesn't dilate until 6 centimeters, dilate less than 6 centimeters for more than 20 hours, and the multiparous is more than 14 for more than 14 hours. Basically, the most common cause is analgesia, and the management is essentially rest. In the active phase, we have like 2 disorders as well, one called protraction and arrest. Protraction is basically when this the dilation of the cervix is slower than expected, and also can be presented with inadequate contraction. What is meaning like slower than expected? We expect in the primiparous woman to be more than 1.2 centimeters per hour, meaning like if you have the cervix dilate less than 1.2 centimeters per hour, we term that as protraction or protracted active phase or stage 1. And in the multiparous has to be like less than 1.5 centimeters per hour. When we consider arrest meaning like no cervical change, no cervical dilation, more than 4 hours or more than 6 hours, we can find like inadequate contraction. Inadequate contraction is defined like when the contraction is less than 200 Montevideos per unit. The stage 2 is goes from when the cervix is fully dilated until the delivery of the newborn. In primiparous, is gonna last 30 minutes to 3 hours. Some books are gonna tell like it's 2 hours, and multiparous is 5 minutes to 30 minutes. Some books again is gonna tell you like it's 1 hour. In the stage 3 is from the delivery of the baby or the newborn until the delivery of the placenta, and lasts approximately 30 minutes. Basically here we have like a stage 1. Latent phase is from the onset or adequate contraction. The patient feels adequate contraction. You measure, and the contraction lasts more than 45 to 60 seconds, has an intensity or 50 millimeters of mercury, and occurs every 2 and 3 minutes until the cervix is 6 centimeters approximately. And the active phase, we have different phases here, but that is not important. And the second stage is from like the cervix is fully dilated until the delivery of the baby. Second stage, arrest of labor. Also, this depends if the patient is nulliparous or primiparous or multiparous, and if the patient has received epidural anesthesia. If the patient is nulliparous and no epidural anesthesia, if it is more than 3 hours, we consider it second stage arrest of labor. But if the patient receives epidural and is nulliparous, more than 4 hours is second stage arrest of labor. The patient is multiparous, no epidural, more than 2 hours, we consider like second stage arrest of labor. And if the patient is multiparous and epidural, more than 3 hours is considered like second stage arrest of labor. What is the main causes? Essentially, is cephalopelvic disproportion, meaning like the head of the baby is larger than the opening. Also, like malposition or fetal malposition, when the baby is no adequate place in the uterus. Also, there is inadequate contractions, or simply the mother is exhausted. What is the treatment for that? The treatment is basically a C-section if the fetal head is not engaged, or otherwise if the fetal head is engaged, we are gonna perform a forces of vacuum extraction. And basically one more thing, the stage 3, also we can have like a prolonged third stage that basically is failure to deliver the placenta within 30 minutes. And the causes could be like placenta accreta, increta, or percreta. What does that mean? The placenta is not normal. The placenta is embedded in the myometrium. And the management is IV oxytocin. Also, we are going to consider manual removal, or finally hysterectomy. So basically, this was the first video that I am recording. There's going to be more. I'm going to improve more, obviously. And thank you for watching.